गुजरने को खून चला आँखों के शीशे में उभरने को खून चला बदन से टपक कर ज़मीं से लिपट कर गलियों से रस्तों से उभर कर उमड़ कर नए रंग भरने को खून चला उंगली मुझे दर्द के काबिल बना दिया, तूफान को ही कश्ती का साहिल बना दिया, बेचैनियां समेट के सारे जहान की, जब कुछ न बन सका तो मेरा दिल बना दिया। ओ साथी तेरे बिना राही करा दिखे ना।
तुमसे मिलके दिल का है जो हाल क्या कहे, हो गया है कैसा ये कमाल क्या कहे। तुमसे मिलके दिल का है जो हाल क्या कहे, हो गया है कैसा ये कमाल क्या कहे।
One more remix.
दिल धड़काए और सीटी बजाए, दिल धड़काए सीटी बजाए, बीच सड़क पे नखरे दिखाए सारे, हो करके इशारे, हो लड़की हो लड़की हो लड़की आंख मारे हो लड़की आंख मारे हो लड़की आंख मारे।
Once more तो बनता है. Here they come upon to rock on the stage.
अल्लाह मुझे दर्द के काबिल बना दिया, तूफान को ही कश्ती का साहिल बना दिया, बेचैनियां समेट के सारे जहान की, जब कुछ न बन सका तो मेरा दिल बना दिया। ओ साथी तेरे बिना राही
हाय तुमसे मिलके दिल का है जो हाल क्या कहें, हो गया है कैसा ये कमाल क्या कहें। तुमसे मिलके दिल का है जो हाल क्या कहें, हो गया है कैसा ये कमाल क्या कहें।
One more remix.
दिल धड़काए और सीटी बजाए, दिल धड़काए सीटी बजाए, बीच सड़क पे नखरे दिखाए सारे हो करके इशारे। हो लड़की हो लड़की हो लड़की आंख मारे आंख मारे, हो लड़की आंख मारे आंख मारे, हो लड़की आंख मारे।
Performance.
Now we call upon Mamta ma'am and Radhika ma'am for prize distribution.
To all the students, in fact, when we walked in, I think people mistook them for some performers who have come from outside. So a really big round of applause to all of you.
These of competitions in the morning today. So for that, we are going to give some prizes. There were Rangoli competitions, Mehndi competition and chart making competition. So Rangoli competition prizes are, the third prize goes to Dishani Pawar. Second prize.
Gita will help us move our kamariyas.
छोड़ दे घबराना, बजाए तू दूर से होने क्या, दिल के सारे बटन खोल दे, खुल के बोल दे, सह मेरे हो ना, बता दे तेरा आज है प्लान क्या।
आज बिजली भी गिरवानी है, फायर भी लगवानी है, तो तू आके बेबी हमारे साथ मां आ आ आ आ के कमरिया Najaria, Maria, Najaria.
But can everyone sing? Let us call on the stage our students who will take you on a melodious trip with us.
ओरे मनवा तू तो बाबरा है, तू ही जाने तू क्या सोचता है, तू ही जाने तू क्या सोचता है बाबरे, क्यों दिखाए सपने तू सोते जागते, जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद,
नैनों को मूंद मूंद,
जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद, कैसे मैं चलूं देख ना सकूं अनजाने रास्ते।
गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा, गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा, धीमे बोले कोई एक तारा धीमे बोले कोई एक तारा, गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा।
कोई मैं कहानी, पूरी कहानी है क्या किसे है पता, मैं तो किसी की होके ये भी न जानी, रुत है ये दो पल की या रहेगी सदा,
किसे है पता, किसे है पता, किसे है पता।
जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद,
नैनों को मूंद मूंद,
जो बरसे सपने बूंद बूंद नैनों को मूंद मूंद, कैसे मैं चलूं देख ना सकूं अनजाने रास्ते।
गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा, गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा, धीमे बोले कोई एक तारा धीमे बोले कोई एक तारा, गूंजा सा है कोई एक तारा गूंजा सा है कोई एक तारा।
Please give a big hand to Sejal and Roshan who just sang this.
रुक जाओ दिल दीवाने, पूछूं तो मैं जरा, लड़की है या है जादू, खुशबू है या नशा, रुक जाओ दिल दीवाने, पूछूं तो मैं जरा, लड़की है या है जादू, खुशबू है या नशा, पास वो आए तो छुके मैं देखूं जरा, रुक जा ओ दिल दीवाने, पूछूं तो मैं जरा।
देखे वो इधर हंस के बेखबर थाम के दिल हम खड़े हैं गुमसुम सी नजर उसकी है मगर होठों पे शिकवे बड़े हैं बात बन जाए तो मैं बात छेड़ू जरा रुक जा ओ दिल दीवाने पूछूं तो मैं जरा लड़की है या है जादू खुशबू है या नशा तू ही तो नहीं रूठ तू इसलिए अकेली जिस पे यूं फिदा ये दिल हो गया वो तो है तेरी सहेली मान वो जाए तो बाहों में ले लूं जरा रुक जा ओ दिल दीवाने पूछूं तो मैं जरा लड़की है या है जादू खुशबू है या नशा आए तो झुके में देखूं जरा रुक जा ला 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 la 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 la.
Thank you.
All these lovely people work at the
Endowment lecture and award. So I hand over the mic to Dr. Radhika.
And all, to go ahead from here, we have a very special person in our midst. I would like to request Ms. Geeta Gopalakrishnan, a dear friend of Dr. Natarajan, and she's also the Director Donor Relationships at Tata Medical Center, Calcutta. Geeta.
Dr. and Mrs. Sadda, nenu milaga Telugu biddane andi. Deputy High Commissioner, Shri Mohammad Lutfur Rahman. আপনাকে ফাংশনে আমন্ত্রিত করতে আমি খুব আনন্দিত Guest of honor, Ms. Sujata Rathod, Dr. Natarajan and friends. A warm welcome to the 6th Professor N.S. Sundaram and Mrs. Kamala Sundaram Public Endowment Lecture Award. There is a wonderful saying which I'd like to share with all of you, and I'm sure you'll agree. We are always 5-year-olds in the presence of our parents. We are always 5 years old in the presence of our parents, but even so in their absence. Parental love is one that is selfless, unconditional, and forgiving. And it is with this sentiment that Dr. Natarajan and his wonderful grandmother have invited you all today. Please give a hand. She's coming forward to the wonderful parents, the mother of Dr. Natarajan's parents. Like a child of 10. Archie and friends, there is a wonderful Tamil saying, Avanandri oranavum ashayadu. Not a blade of grass moves without divine will. Call him Ram or Allah or Jesus. We are nothing without divine grace. Aditya Jyot Institute of Optometry will do the invocation song to ask for this grace, to grant vision to the visually challenged so that they too can see life filled with color.
महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा गुरु ब्रह्मा गुरु विष्णु गुरुदेवो महेश्वरा गुरु साक्षात् परब्रह्म तस्मै श्री गुरवे नमः त्वमेव माता च पिता त्वमेव त्वमेव बन्धु च सखा त्वमेव त्वमेव विद्या द्रविणं त्वमेव त्वमेव सर्वं मम देव देव
Request Dr. Sadda, the Deputy High Commissioner of Bangladesh, Mr. Rahman, Ms. Sujata Rathod and Dr. Natarajan to light the lamp. Please light the lamp and flame of hope.
Apologies for the delay. Are we on? It's playing here. I won't be able to see, is it? All right. Okay. So the evolution of Aditya Jyot Eye Hospital, I think most of us here would know. It's been a eventful journey. I'd just like to share this very good news that we have been voted as the best eye hospital in the nation, and this has been pretty recent. And it has been published in The Week, which is a very popular magazine. That was something which I wanted to start the session with. So let's look at a few key points about the history, infrastructure, what we do now, what is the expertise, what are the patients saying about us, what is the media saying about us. We all know it was founded in 1990 by Padma Shri Dr. S. Natarajan. It was started in Dadar. And it has moved in ways, ways beyond, I'm sure even his own imaginations, it's reached to bigger and bigger heights. It was initially known as one of the premier retina institutes in the world, which it still is, but it currently also houses a lot of subspecialty departments, which I shall talk about in detail. This was in the beginning in 1990 in Dadar, and this is what it is currently. It's a 3-storied building in Wadala, as we all know about it. In 1990, Dr. Badrinath inaugurated the hospital. That was, when it was just started, and I think Dr. Natarajan at that point was doing only retina work. And gradually, a few specialities like cataract, LASIK started being added. And in 2001, the LASIK center was inaugurated by Padma Bhushan Badrinath sir. That was he's also the chairman of Shankara Netralaya. I think Aditya Jyot was one of the first few places in Mumbai to have the LASIK machine. The current hospital as it now stands was inaugurated in 2004 by Sushil Kumar Shinde ji, the then Chief Minister of Maharashtra. Mrs. Aishwarya Rai Bachchan, whom we all know, she inaugurated our eye bank, which is now very much functional, and we are doing a large number of corneal transplants every year. And again, we had Ms. Selina Jetli, who promoted eye donation in 2009. And we had several celebrities endorsing us online, offline since then. Dr. Natarajan this is Dr. Natarajan with the then President Abdul Kalam in 2005. A little bit about our hospital. Is one of the first few NABH accredited eye hospitals in Mumbai. It is the only hospital to be a full member of the World Association of Eye Hospital. It has been visited by the former President and also the Chief Minister. Sorry, that Dr. Natarajan, he is not only an excellent eye surgeon but also a philanthropist. So he's been doing a lot of charitable, I'm sure, work which Dr. Radhika, I'm sure, will talk about in detail. The pellet gun injuries out there, the patients also come here to us where
they're seen by Dr. Natarajan in spite of his busy schedule. And this was something I really wanted to highlight because I know it is very dear to Sir's heart also. Just moving forward, because it is brief, I really can't cover everything that he does, so let's be brief about that. The vision of our hospital is to provide world-class eye care service under one roof. Our mission is to remain attentive to eye care and well-being of those who serve with 100% patient satisfaction. A policy, many, but of course to excel in the field of ophthalmology and ocular surgery, provide international quality treatment, and this is something which I have to definitely vouch for. I've been here for about a decade and I have also studied internationally and visited a lot of international centers, and I have to tell you that being in a lot of operating theatres abroad, I have to tell you that the Aditya Jyot operating theatre is definitely on par, in fact even better than most of the places which I have seen in the US, especially the way we maintain sterility, the high-end equipment which we keep upgrading month after month. And we do accept patients of all socioeconomic status. We do not have any kind of discrimination whether the patient can pay, not pay. The entire focus is on treating the patients. Now, as I said, we boast of 3 theatres. This is also the wards which we have, general ward, special ward. Now, from Retina Center, a lot of specialities have been added and it has grown into a very large eye care specialty center. These are the various subspecialties that we have: cornea, oculoplasty, neuro-ophthalmology, glaucoma, pediatric officer for Aditya Jyot, the first retinal endoscope, the first constellation vitrectomy, and the first IOL master, first infinity phaco machine. We've recently advanced equipment for diagnosing retinal vascular as well as any retinal disease. The cornea cataract LASIK center, I think, is close to my heart. I have to talk a little bit in detail about this. We are doing all kinds of specialized treatments from LASIK, bladeless LASIK, SMILE. We have the Excimer 500, which is one of the fastest machines in the world right now, currently housed at the Vadala Center. We're also doing bladeless LASIK, where the flap is made without using a blade. We're doing corneal transplants, patients who come to us with this after surgery. This is before surgery, after surgery. We're also doing most advanced treatments for keratoconus, where we not only regain vision, we also halt their progression. Just we also covered extensively in media about all our work that we do. A patient may come to us with a black and white. It could be because of a cataract, could be because of a dense black scar or white scar or a black cataract, but we essentially move them to a vision. And just like to end with this short video. This is about what the patient is talking. Can we have the volume, please? Sorry?
Close.
No, I want the volume in the video. Is it there? Anyways, just... Young patient who came to us, and in her own words, how she had her experience where she'd been referred to us for actually a corneal transplant, but we got away with just doing a PTK and her vision improved, and how she was really happy not only with the doctor but with the entire team, starting from the reception to to the doctor, and that was her words of gratitude. So that's all. I thank you all for your attention, and I think we can go ahead with inaugurating the program. Thank you very much.
I take this opportunity to talk a bit about the work that the Aditya Jyot Foundation for Twinkling Little Eyes has been doing. Many of you may be aware, but we've been making, taking a lot of steps forward in this, in our not-for-profit. A bit about us: we were registered in 2005. The desire coming from Dr. Natarajan for giving something back to society. Our vision is a society that's awakened to the basics of eye care and free of preventable eye diseases, and mission to render charitable services through a system built on society participation to ensure quality eye care to all. We have, since our inception, touched more than 8 million lives across the state. to specifically state in our urban community-based program that we are doing in the slums, more than 1,70,000 slum households have been enumerated, where our health workers who are here have been going door to door, creating awareness on various eye diseases, both in children and in adults. We've been conducting camps for cataract, glaucoma, diabetic retinopathy, pediatric eye diseases. And our major supporter has been the World Diabetes Foundation. Currently, the Tata Trust is a big donor supporting us in our activity. We run centers in the slums, in Dharavi, in Kandivali, and also a surgical center in Mulund. These are vision centers which are basically equipped to do vision screening, provide glasses, do cataract screening, prepare the patients for cataract surgery, evaluate for retinal disorders, glaucoma, evaluate for squint and pediatric diseases. Similarly, in Kandivali, we've been running these centers, the Dharavi one since 2011 and the Kandivali center since 2014. Because retinal surgeries per se, unlike cataract, are more expensive. So we have tied up with another NGO where we have set up indigenous equipment to provide these surgeries. We've been doing special camps for school children. We have an MOU with the municipal corporation where we've been doing these eye screening activities for municipal children and providing them with free glasses, free surgeries, vision therapy. We also target vulnerable groups like the orphanages, the old age homes. We have special attention, thanks to Mr. Shivanandan, to the police personnel. That's an ongoing activity that we keep doing. These are some snapshots of the work that we do. And another population that we've identified are the truck drivers, which I think it may come as a shocker to many of you that unfortunately in India, unlike the Western countries, we don't seem to have specific guidelines for renewal of licenses of truck drivers. So, including whatever they get in terms of their insurance renewal. So, we find a lot of truck drivers with eye diseases, uncorrected vision problems, which are contributing to a number of accidents and loss of lives and limbs. So, we've been trying to help them correct that. The ongoing projects that we've been running since 2011, the CREAM project, we've tried to name them in such a way that it will interest people so that we can raise contributions. It's the Children's Refractive Error Eye Ailment Management Project, the Aditya Jyot Diabetic Retinopathy Urban Mumbai Slum Study, the Pediatric Eye Anomalies Refractive Error and Traumatic Lesion Study, which has been named after Dr. APJ Abdul Kalam. So we've screened more than about 20,000 children in our CREAM project, where we focus on school kids in BMC schools. And in the diabetic retinopathy project, we have a mobile van which is equipped both with a fundus camera as well as a laser machine, so that not only do we diagnose, but we also provide preliminary treatment in the form of lasers to those who are affected by diabetic retinopathy. In the pediatric, the slum-based pediatric project that we do, we are providing them with free glasses. Those who are identified for either squint or cataract surgery or any other vision problems are referred to our hospital, to the pediatric ophthalmologist. We also have undertaken research in a small way. The R&D unit of the foundation is the Aditya Jyot Research in Vision and Ophthalmology. And the areas of research undertaken are in diabetic retinopathy, inherited eye diseases, and age-related macular degeneration. This is a small genetic research lab that we have right now in Chunabatti. And we also propose to set up an image reading center where, considering the amount of work that we've been doing on diabetic retinopathy, which we have extended across the state, we hope to facilitate early diagnosis by providing underserved population in rural pockets or in tribal areas with more or less an immediate diagnosis, so that the patients can be referred to higher centers at an early stage. And we are also undertaking research on macular degeneration, Stargardt's disease, and the AMD. Thank you. Thanks for your time.
We are all here for the 6th Endowment Award by the name of Professor Dr. S. Natarajan's late father and mother, Dr. Sundaram and Srimati Kamala Sundaram. So Dr. Sundaram, who was MBBS, MS and DO, born in 1927 at Tamil Nadu, he was a retired superintendent from Government Ophthalmic Hospital and also served as a professor of ophthalmology in Madras Medical College. So in and all, counting from his grandfather, his father and Dr. Natarajan, it sums up as 150 years of service to nation. Dr. N.S. Sundaram, during his tenure, he had 9 special clinics started, cornea, lens, retina, genetics, uvea, and also a special clinic on genetics, which was first of its kind introduced by Government of Tamil Nadu. He also performed over 30,000 cataract surgeries for poor and undeserving, individuals, and organized also more than 1 million surgeries at the Science and Technology Center, Trichy, in 2000. These are some of the photographs from the eye exhibitions. He also is a proud author of many books, one of them called Eye Care for both young and old, ophthalmology. Dr. N.S. Sundaram was a proud recipient of multiple awards, some of them being Seva Ratna by Centenarian Trust in 1999, Vaidya Ratna by Sri Kanchi Kamakoti Jayendra Swamigal in 2000, and Lifetime Achievement Award by Tamil Nadu Ophthalmic Association, Dr. G.V. Award for Community Ophthalmology, to name a few. He proudly said that vision is our mission. This is the mother of Professor Dr. N.S. Natarajan. Lastly, Dr. N.S. Sundaram served as the rector of Aditya Jyot Institute of Optometry and mentor of Aditya Jyot Foundation for Twinkling Little Eyes. The previous recipients of this endowment award are Dr. Gyan John Prakash, Dr. Neil Bressler, Dr. Marco Mura, Dr. Rishi Singh, Dr. Francisco Bandelo. And the proud recipient of the 6th Endowment Award is Dr. Shrinivas Sadda. We welcome you all. We welcome you, sir.
Friends, just a few words on the wonderful pair. To say a few words about Dr. Sadda, reading from a scroll, followed by honoring him with a shawl and a plaque.
That we are all congregated here in my parents' name. And I have I'll now read the citation which is prepared for the Aditya Jyot Eye Hospital presents the scroll of honor on the occasion of the 6th Professor N.S. Sundaram and Mrs. Kamala Sundaram Public Endowment Award on Saturday, 22nd December 2018 to Professor Dr. Shrinivas Sadda, President and Chief Scientific Officer of the Doheny Eye Institute, the Stephen J. Rand, Arnold and Mabon Becken Endowed Chair, and Professor of Ophthalmology at the University of California, Los Angeles. His major research interests include automated retinal image analysis, substructure assessment, and advanced retinal imaging technologies. He has more than 380 peer-reviewed publications and 13 book chapters and has given over 350 presentations worldwide. Dr. Sadda also serves as an editorial board member of Ophthalmic Surgery, Lasers and Imaging in Retina, Graph-Face Ophthalmology, and Ophthalmology. He is also an editor of the 5th edition of Ryan's Retina textbook. Among Dr. Sadda's awards and honors are Research to Prevent Blindness, Physician Scientist Award, a Senior Honor Award from the American Society of Retina Specialists, an Achievement Award, and a Secretariat Award from the American Academy of Ophthalmology, John H. Zumberg Research and Innovation Award, the Macula Society Young Investigator Award, Asia Pacific Academy of Ophthalmology Achievement Award, the Macula Society Paul Henkin Lecture and Award, and the American Society of Retina Specialists Young Investigator Award, he has also received the Silver Fellow designation from the Association for Research in Vision and Ophthalmology. He has been named on the Best Doctors of America list for several consecutive years and signed by Dr. Natarajan and myself. And I am very happy that not only with all these accolades, I think I wanted to say that he is a great Indian, and I think born in Guntur, but living from the age of 4 years in United States. And I think he comes to India almost every month, and I think I asked him how he travels so much, but I think that's his dedication. And I would request Geeta, I think you're going to ask him to come to the stage now.
Yeah.
To receive
so, Dr. Sadda, please.
Give the plaque. Can I have the plaque? And can we have Dr. Mamta to be here, and Jaya and Neil. Jaya is in the 11th grade and Neil is in the 5th grade, and it's a great honor. I think you should know that we all revere your dad, because what he's doing for India, apart from his clinical acumen and all his contributions to imaging. And I think apart from that, he's also helping us to be part of the imaging research with what he's doing in the world. And I think I would like everybody to give a standing ovation for the Shrinivas Sadda. Where is the plaque?
Dr. Natarajan, for this great honor to be able to give this lecture in the name of your parents. Of course, Dr. Natarajan is now a third-generation ophthalmologist, so a wonderful tradition in his family. It's also a great honor to be able to give this lecture with Dr. Natarajan's grandmother also here in the audience. So again, I very much treasure this recognition, again, opportunity to speak on this. And given Dr. Sundaram's statement that vision is our mission, it seemed appropriate to talk about what we can do going forward in the future in terms of stopping blindness from diabetic retinopathy, because I know that's an important focus of Aditya Jyoth's eye hospital and Dr. Natarajan, and I think there are great opportunities for us in this current time. So I want to give sort of a general introduction, because I know many here are not ophthalmologists or familiar in detail with the eye. But let me step back first to talk a little bit about diabetes, because we know that this is a disease where there is an impairment in our body's ability to utilize and store sugar. And depending on why we have that ability, we can classify it as type 1 or type 2. That's not so important. But the bottom line is that these patients have elevation and high levels of sugar in the blood. And this elevation of the blood sugar leads to a number of problems. In particular, it leads to damage to the blood vessels and nerve cells throughout the body, including in the eye. But obviously, many other parts of the body aside from the eye can be affected, including the kidneys, the heart, and our brain. The damage that occurs to the eye, that we term primarily diabetic retinopathy. And it's a big problem because diabetes is a big problem. We are currently experiencing an epidemic of diabetes worldwide. Almost 500 million diabetics now, and we're expecting that to dramatically rise heading into the future. And you can see in this map that this part of the world in South Asia and in even Eastern Asia really is one of the worst areas. In fact, this was an excerpt from the Times of India, where they claimed that India is the diabetes capital of the world. And in many regards, that unfortunately is true. And in fact, there were 72 million cases in 2017, and we expect that to rise to 134 million by 2025. And this is in some ways mirrored the rise in incomes. And again, it's quite incredible when you think about the rise in diabetes over this period of time. Another interesting thing about diabetes in India is that diabetes appears to strike Indians about a decade earlier than in other countries. So not only do we have such a high rate of diabetes, we also are getting it in younger individuals. And why that is, there are many complicated reasons, obviously, but genetic factors are likely involved. One of the concepts I think that's a recurring theme is that we see as you have increasing wealth and economic development in a country, that often is associated with inactivity and excessive consumption of high-calorie foods, and there's no question this is a major association with diabetes. What's even worse, though, is this trickles down, and in particular to the urban poor, they're also prone to this, and actually they're even more prone because they oftentimes tend to have less knowledge and awareness of these issues. So this becomes a vicious cycle, and unfortunately we're stuck in India. We're seeing this as a problem. But as I mentioned, diabetes can affect all parts of our body, and in particular the blood vessels. But the reason we have a focus in the eye is, one, obviously we all care about vision. Obviously it can affect our vision. But what's happening in the eye is really a great tool that tells us what's happening in the rest of the body. So sometimes we hear eyes are the window to the soul, and in many ways that's true in the case of diabetes. The eyes really tell us what's happening. So as we heard in some of the previous presentation, the eye is also quite unique, and in the retina in particular, in that we can actually study it. We can see it on examination. When your ophthalmologist looks through these special lenses, the retina comes into view, and we're able to study the effects of the disease. And in fact, as you heard, these findings can be photographed. We have special types of cameras we call fundus cameras, so they can capture pictures of the retina that can help us in studying what's happening in a patient's eye. But I thought I will even take a step back, because maybe not everyone is familiar. We use terms retina, macula, we throw them around, but maybe not everyone is familiar. What do we mean by that? And so this is a common problem, and so we spend a lot of time in the clinics explaining these eye diseases to our patients. And one analogy that I found very helpful for people to understand is this analogy between the eye and a camera, because it works very similar in many ways to a camera. You have a lens in the eye, much like a camera lens, and when that gets cloudy, we call it a cataract. But the retina is very analogous to the film of the camera. So it contains the special light-sensitive cells. Light is brought into focus by the lens system in the eye onto the retina, and the retina very much operates like the film of a camera. So it's a very good analogy in that regard. And then you'll hear terms, sometimes some of you may have heard the term macula. Macula refers to the very center part of the retina. So what we use for our straight-ahead vision, to read, watch TV, to drive, all of that depends on our macula. That's our sharpest vision. But that's that portion of the retina that you can see, and happens to be in this retinal picture right in the middle. In addition, one thing to understand is, even though the retina is like the film of the eye, it is quite thin. In fact, it's about 1/3 of a millimeter in thickness. But even though it's that thin, it's actually incredibly complicated. The diagram to your right shows a cartoon and then actually a microscopic picture of the different layers of cells in the retina. It's a very complex structure, a lot of processing that's happening within the retina, but even though it's only 1/3 of a millimeter thick. So what is diabetic retinopathy? Again, as I said, the most important aspect of diabetic retinopathy, at least that we can see, is what is it doing to the blood vessels. And some of the earliest changes that we see in diabetes is something we call a microaneurysm. These are really tiny, tiny aneurysms. An aneurysm being sort of a ballooning out of a vessel. So the little balloon dilation of the vessel, we call that an aneurysm. And those aneurysms can be bad because when you have a ballooning out of the vessel, it loses its integrity and it can become leaky. So the fats, the proteins, water from the blood can seep out. In fact, this is in this picture, again, you don't have to, I've shown you some normal retina pictures, and if you look at this, you can say, wow, there's all this other yellow material here. What is that yellow material? That's the fat that's leaked out of the bloodstream and into the retina. You can imagine that's probably not a good thing for one's vision. In fact, if there's enough leakage, the retina can swell. And so we have special cameras. There was a mention of this in one of the previous presentations as well, of OCT cameras. These are cameras that actually allow us to see the layers of the retina. So again, this is only 1/3 of a millimeter, but we have the ability to study this. And then we can see, like in the example in the bottom, where you don't have to be a retina expert to see that that looks abnormal. There are all those dark spaces there. That's fluid that's accumulated in the retina. Some of the bright structures in that image are actually the fats. And you can imagine that if you have all of this material accumulating, retina's not going to function well. So we call this macular, again, in the macula in the center, edema. Edema just means swelling. And so that is one way that a diabetic patient can lose vision. Now, as you get progressively worse injury to the vessels, you can actually get frank bleeding, which basically means the blood cells also come out of the vessels. And so you can see, again, you don't have to be a retina expert to see there's all those red spots there. Those are all areas of bleeding. And eventually, as the damage progresses, the capillaries can actually get clogged or occluded, and you can get little strokes where there's loss of blood supply to those parts of the retina. And then the retina swells up and it turns white like this. We call them cotton wool spots because they look almost like cotton balls there. But those are little areas of permanent injury to the retina. Now, we also have the ability, Dr. Natarajan does this all the time in his hospital, where you can inject a dye into the arm, we call it fluorescein dye, and take pictures, and you can see the circulation and all those fine capillaries quite well. And now, of course, there's even newer technology, something called OCT angiography, where again we're going to be able to see the fine capillaries in the macula without any dye now, which is really quite remarkable. But you can imagine if you lose the capillaries and you lose the blood supply to the retina, you can also lose vision. It doesn't have to swell. Just loss of the vessels can cause the tissue not to function. We call this macular ischemia. Ischemia means injury due to lack of blood flow. Now, unfortunately, this is not where this story ends. As the damage progresses, and more capillaries close, the body responds by trying to make new blood vessels. And you might think that's a good thing. But actually it turns out that these new blood vessels, they don't form in the right area. They form on the retinal surface, and they're prone to bleed, and they bleed into the middle cavity of the eye. We call that the vitreous. And the eye can actually fill up with blood as a result of bleeding from these fragile new vessels. And then again, you can see that if you have a big vitreous hemorrhage blocking the retina, how does the light get to the retina for us to see? It can't. That's why this can affect the vision. And if these new vessels that appear, they're left untreated, they can progress and you can get scarring, and eventually that scars can contract and pull on the retina, detach the retina from the eye wall, producing these types of devastating retinal detachments. Again, you can see all the scar tissue that's developed here. And now, people like Dr. Natarajan have advanced surgical techniques and the ability to actually repair some of this type of damage, but even this can be very difficult. In some cases, there's nothing we can do, and this can lead to permanent blindness. And so this really, I think, to summarize, this is kind of the summary of what I've just presented. There are really three major reasons why a patient with diabetes, again, hugely common problem, can lose vision, either due to swelling, diabetic macular edema, loss of the capillaries, macular ischemia, or this type of problem with the hemorrhage and then the detachment, as we discussed. So, the devastating aspect of diabetes, and again, as I said, India unfortunately is kind of like ground zero, one of the worst in the world in this regard. But the reason it's so devastating is that it affects working age individuals. And increasingly people are getting younger. I already mentioned to you, Indians in general are developing this problem earlier. And so diabetic blindness really can have a devastating impact on society and a country. So how can we stop this catastrophe? Because the interesting thing is that blindness from diabetes, people say, is over 90% preventable. I mean, so this is a really unfortunate catastrophe because we can do something about it. And so what do you do? Well, as in most things, prevention is the key. Prevention is almost always better than trying to address the problem after it's already really set in. And so, some of the things, and again, I'm not going to go through the detailed data from various studies, but we know, and this is kind of common sense, excellent control of your blood sugars, blood pressure, your cholesterol, not smoking, all these things are ways of protecting your blood vessels. Also, if there is in fact retinal damage, if you can catch it early, maybe when you just have a little bit of swelling or just a few microaneurysms potentially, if it can be detected early before permanent damage has ensued, then you could actually prevent blindness, right? So we can do laser, in Aditya Jyota, they do lots of laser treatments for diabetics. But you'd like to do them early before permanent damage has occurred. Now we even have eye injections of medications that we can put into the eye that stop the leakage from these blood vessels that I mentioned. So the advances have been quite remarkable. Just even since when I trained, we didn't have eye injections. This was back 20 years ago, but this is a relatively newer innovation. And again, we have great opportunities if we're able to catch the patients early on. So how do you detect it early? Well, the key is regular screening. So in the US, the American Academy of Ophthalmology has a recommendation that every diabetic needs to have an annual eye exam, and if some retinopathy is spotted, then they need to be seen more frequently. Now, unfortunately, it's not such an easy situation. And actually, I was saying that we have a big problem here in India, but quite frankly, where we live in Los Angeles, we have a similar problem. We have a huge problem with diabetics coming in for screening. And this, I don't know how well this is projecting to the back, but this is just a list of various reasons why people don't come in for screening. Some of it is because diabetic patients have other health problems, too busy to come. But another problem is that you could have a lot of damage in your eyes and not know it. May not affect your vision. And so some don't come in because they say, I'm busy. They're working. Most of these are working people. Busy, don't detect a problem, don't come in to get checked. So this is a big challenge. Another challenge, of course, and this is a challenge in India, but not just in India, in many places in the world, is that, again, we have this explosion of diabetics and maybe not enough eye experts to actually get them timely exams. For example, in Los Angeles County, where we live, we have sometimes like patients waiting, we have to wait a year because there might be thousands of patients backlogged to be able to come in for screening. So how can we increase access to screening? You heard some of this, and one of the models that has been promoted worldwide is this concept of telescreening. I mentioned how we have this unique capability in ophthalmology that we can photograph the retina. So you can imagine that you can photograph the retina maybe when the patient comes to their internist for their insulin or their other diabetic medication, and they get the images taken there. And then the images can be sent to a central location, like a reading center that you heard that there's an interest in developing one in Mumbai as well. We have one in Los Angeles, for example. And then these images are reviewed by experts, and the images with this model. Let's say you want to put a camera in the internist's office or the person who's taking care of the diabetes. Well, there's still the expense of the camera, and the patient still has to come in and stay extra time to get the pictures taken, so that can still be a barrier. So that's where I think bringing care to the patient or the community is really important. We have this type of facility at UCLA where I'm at, where we have a mobile eye clinic actually that goes around to the community to do these kinds of services. And I was very pleased to see earlier today with Professor Dr. Natarajan that there's a similar, you heard that presentation, that this kind of a van, I think, is a great option for trying to bring care to people, to try to overcome this barrier for getting screening, and I'm excited about the program that they've developed, and they've taken it one step further, because even a van can sometimes be expensive, and you can imagine there may be some areas you can't access, so they've taken it one step further. I mean, this is quite incredible that they've put a portable camera that can be transported on a motorbike. There's probably nowhere you can't get to using this type of a strategy, and of course it's possible now because we have lower cost fundus cameras that are able to be small and easily portable, like the one that they're using, Tijot. I mean, these are great tools for us to be able to better do this type of telescreening approach. And we think there are great opportunities. You can even buy little attachments to your smartphone to take pictures of your own retina. There are even applications now that can process your images. So we really have the ability to do a lot of this type of an assessment. There's still other potential costs, delays, and another barrier could be that most telemedicine models right now still rely on some expert image reading center or someone to analyze the images, and that also I think is an important barrier, but that's also something that's being addressed. So we are in this amazing age of advances in computer processing and technology, and there are a number of systems that are now available for doing automated diabetic retinopathy screening. One of them actually I should say, I just want to make a point that again, I don't want to get into the minutiae, the details, but I've been very involved in this kind of work. This is work we did in collaboration with Adnan Tufail at Moorfields, where we evaluated all of these systems to kind of see which one would perform the best. I will say that one of them actually is even FDA cleared in the U.S., and the one that I've worked the most with is with this system called iArt from this company iNook. They actually are in our area near Los Angeles. This is actually a company of Indians actually who are in Thousand Oaks, California, and they've developed a system. They've just completed their FDA trial. We'll probably have the results, and hopefully they'll have FDA approval very soon as well. But again, the concept here is that you get the images from whatever camera system, doesn't really matter, and they can be uploaded to the cloud, and then this system can determine whether the patient needs to come in urgently for an eye appointment or not. And so first it assesses whether the images even can be assessed or not, whether the quality is sufficient, but then it makes this final determination. And actually, the systems, we've published papers to show that it can perform quite well with a high sensitivity for detecting the disease, and it even can work with smartphone-based acquired images. So that's one of the beauties of this type of a system. And in fact, the performance was so good. This was another a technology assessment that I authored with Adnan Tufail, and in the UK, they have a very well-developed screening system, okay, which involves sending the images to expert graders in the center. But they've said that actually they have a couple of different graders of different expertise look at the images, but they've said that they feel good enough now that they feel that the systems, the automated systems, that's what I'm circling here, are good enough they can be inserted into the work stream now. So the images come, the automated system makes the assessment first, and then maybe the images can be rechecked, a certain percentage of them, by a human expert. So we're at that point where we may be able to do some automated assessment. But really, where are we headed? I mean, what's really exciting, or scary, depending on your perspective, is that we may have the ability to completely replace human assessment of these images through artificial intelligence techniques. So many of you may have, I'm sure everyone here has heard something about artificial intelligence because it's such a big topic, all the rage now. We've been doing a lot of work in this area. But basically what artificial intelligence means is you're mimicking the cognitive function of human beings, primarily learning and problem solving. And there are many examples in the US, especially this has become very popular, this concept of self-driving cars. There are many cities that have these pilot programs, and so people are expecting that in the next 5-10 years we'll be shifting to self-driving cars. But there are other examples that artificial intelligence systems have been deployed. One of them has been in game playing, like beating human opponents in various different games. They can do quite well. But the great achievement, I think last year, this was in 2017, was that a artificial intelligence system, this was IBM Watson in this case, actually won against the world's poker champions. So it wasn't just a matter of mathematical probability. It had to actually learn something about the opponent, intuition, which is kind of amazing. So we're not quite to replacing a human being with artificial intelligence, but we're getting closer. And so when you think about, most of us, the most common application most of us probably use artificial intelligence systems is in our smartphones. Again, we can automatically detect whose face is what, and those systems can actually be used from a medical application as well. For example, I can simply take an image of a diabetic patient who was stable, and then take a picture of a diabetic patient who got worse, and then I can train it with thousands of examples. It'll automatically figure out what's important, because that's what, I'm going to go back 1 second. One of the beauties, people sometimes say, like, what is so special about artificial intelligence? Well, these artificial intelligence systems, I don't tell it. Let's say I want to design a system to distinguish between a cat, a dog, or a monkey. I don't go and tell it, okay, a dog has ears like this, and a cat has a tail like this. I don't tell it anything. I just say, this is a dog, this is a cat. It figures out what's important to distinguish them, and the next time you show it some completely different dog, it's able to say, aha, this is a dog. So that's why I'm saying in medicine, we'd apply it the same way. Let's say, I don't even have to tell it, well, this is the important thing to find to identify a patient with diabetic retinopathy that I'm concerned about. I just say, this is a picture of a patient who stayed stable. This is a picture of a patient who got worse, the bottom picture. And the next time I show it another patient, it'll be able to tell me, is this somebody I should be worried about or not? So that's where we anticipate going with this. And again, Google and a number of other companies, this is from Google's paper in JAMA, where they demonstrate a very high performance with their system. We're doing a lot of work with Google these days as well, and they will likely have a product as well in the next year or two. They'll start their FDA trials soon. So to summarize, I covered a lot of ground, but again, I thought it was appropriate for this lecture because it's such a big problem. So I've emphasized that diabetes and the damage that diabetes causes, diabetic retinopathy, are rising globally at an alarming rate. And I've mentioned that poor diet and a sedentary lifestyle, not getting enough exercise, are major contributors. And this diabetic epidemic, as I mentioned, especially serious in India, maybe the worst in the world. And again, it causes damage to blood vessels throughout the body, but including in the eye. And if it's unchecked, if it progresses unchecked, it causes blindness. There's no way around it. But at the same time, it's eminently preventable. Good control of the diabetes and critically, early detection and treatment are critical for this purpose. And we know that one of the ways we can do early detection is with these types of telescreening systems, like Aditya Jyot's Stop Blindness. Really critical, I think, for maximizing the screening of diabetics. And I've also given you some glimpse into the future, that we're excited about the prospect of artificial intelligence systems which may improve the efficiency of these types of symptoms. So with that, thank you for your attention. And again, really a great honor for me.
Sadda, according to you, when should the first retinal examination should be planned in a diabetic patient?
Well, so it depends on whether it's a type 1 or type 2 diabetic. So type 1 diabetics tend to, when they develop diabetes, it tends to develop very quickly, and they wouldn't have had diabetes for many years. It develops fairly suddenly. Maybe in the US at least, we have a guideline, we say 5 years for their first screening. With type 2 diabetics, which is 90% of the diabetics in the world, most of the diabetics in India will be type 2. For them, sometimes they may have had high blood sugars for many years, don't know, and so we recommend screening immediately. So as soon as they're diagnosed, we recommend the first screening. At least that's the guideline in the US.
Okay. Anyone for a question? Can you pass the mic?
I'm Dr. Ashok Gupta. I'm a plastic surgeon. It's a question about the role of AI in medical education. We had a big symposium a few months back, and everybody talked that AI is welcome, but it's not going to replace the skillful mind and skillful fingers of a physician. But what you have shown, probably the physicians are being totally replaced by the AI in diagnosis of the retinal disease. How far it is going to be accuracy level in future?
So yeah, that's a great question as we try to anticipate how the field of medicine is going to change because of AI. I think it's going to change quite dramatically. But I think there'll always be a role for physicians. I think some physicians are nervous that, well, is this the end for physicians? Because AI can just do a better job. It can, you can essentially, the more information you feed it, the better it'll get, right? You can give it the knowledge of 1,000 doctors by showing it 1,000,000 cases. But of course, it's never going to have probably the bedside manner of a physician. I mean, there are important elements of being a physician that aren't just about making the diagnosis. So I think what we'll see first is we will see AI deployed as a tool to help physicians in making the diagnosis. But I'm guessing that it won't, I can't see in the any time in the immediate future that this replace actually the physician to actually make the contact with the patient. That's kind of how we're anticipating this will be developed, at least in the immediate future. But long time into the distant future, who knows? You might be able to develop, I mean, again, there's something called a singularity, which basically means that you eventually have developed computing technology to the point that you've essentially replicated the human brain. It actually has a conscience. So once you get to that point, then that is almost a life form of its own, and then things could change. But that's, it's a little bit science fiction still, but you're right that it may not be as far away as we thought.
Yeah, good evening, sir. Faye is going to be on the back seat now, or it is going to be passed now?
So that currently can't do. It doesn't show us leakage and the like, which FA can do. And so I anticipate that clearly we do a lot less dye-based angiography now in the US. We do mostly OCT angiography, but it still has a role, dye-based angiography, because OCT angiography can't do everything.
Good evening, doctor. I'm talking to you as an extreme layman. What I have done is I have observed very keenly the proceedings, and I've seen that you, Dr. Natarajan, his team, they're all very slim and trim. So does obesity have anything to do with diabetes? This is my question as a layman.
You were very observant, and we have a great fear of developing diabetes, so we make a great effort to stay active. But also Dr. Natarajan is also very much a world traveler, so very difficult for him to pick up weight as a result.
Hi, sir. I have a question for you. With all your experience of various imaging systems, you think which would be the best in an Indian scenario, the Asian and the Indian eye, the Caucasian eye? What kind of a screening tool would work best in the Indian scenario?
I think that the strategy that you've currently deployed at the with the fundus camera that can be portable, okay, that can get you at least a 45-degree image of the retina. I think that's sufficient for most of what you're trying to detect, at least for these diabetic patients. So I think that's adequate because and actually because of AI and other techniques now, even just with that fundus image, we're getting better and better at detecting even thickening of the retina, edema, and the like. So I think that's fine. I think that the big thing is that I don't think, I mean, one of the things we talked about, we still see a good role for physicians. I don't see much of a role for image reading centers, honestly, in the future. I think that's going to be replaced by AI. And so I think that connecting these programs with AI is going to be essential. Yeah.
Yeah, I think I would just like to add that back home here in India, ones who are the primary people who should be referring to us, but they never do it because they are also under the myth that as long as vision is not disturbed, they don't need to send to us. So I think that's sort of a linking to our physicians mainly, that they should be able to refer diabetics, at least for a baseline evaluation, should be one of the things which we should do in India. And second thing with regard to artificial intelligence, I think with regard to surgery, there's more into neurosurgery and other components rather than into opthal, where we are still at the physician level of identifying things and bringing to the notice. And one more thing which I think Dr. Natarajan and through the AIO is what we are trying to do is creating these equipments to be available at the vision centers, where vision centers are manned by the optometrists who at the grassroots levels will be the main people who can identify this and help us sitting in the tertiary centers to make a diagnosis and stop blindness at that road. Because India still lives in its villages, and as long as we are able to reach door to door, this will take a long way to really reach to them and do better.
Yeah, you're absolutely right. And the piece that I didn't mention is also, as you I think alluded to, is education. So if the internists themselves are not thinking that patients need to have a diabetic eye exam, that's a problem. And so education needs to be married to providing this access.
Do we have any more questions?
Friends at the back, I just want to, all of you who are speaking at the back, can I request?
Nazi, you want something to ask? Okay. In the meantime, Nazimul will ask. And we have Nazimul Hussain, who's our faculty and now in practicing in Dubai. So we have a lot of philanthropists here and nice-minded people. So I'm going to have some appeal. Yeah.
Hello. I just want to add that we also did a similar tele-screening for our patients. That, you know, our scenario is different. We have 20% incidence of diabetes among the population there. So we use the ultra-wide field. I know it's not applicable here, but we use our nursing personnel to do the photography. So in that sense, we did not employ anyone else. So we put the camera in the endocrinology department itself, so they don't have to visit us. So the diabetic educator itself, when she educates on her diabetic medication, she takes the picture. So we trained her, we certified her, and then we read it elsewhere. So we have been able to screen a lot of patients and avoid them from coming to a retina clinic. So we just bought the camera, that's all we did. And we used the same human resources.
Yeah, I think you have to attack the problem at multiple levels. So I think that that getting these tools to the primary care doctors is important. But there are some people who are not even getting to that step or don't have that access. So I think you have to see. One of the things I anticipate for the future when people think about where is AI going to be deployed, but the other component is there's a trend, at least in the U.S., there's a trend towards this concept of biosensors and more home-based diagnostics. So healthcare has gotten very expensive in the U.S. So one of the ways that people are trying to cope with the situation is to say, okay, let's shift the burden to the consumer and say, okay, I'm going to give you tools. Like, for example, now, like, you know, you can have a smartwatch and it can do your EKG. So people are able to, and now when Apple enables it, they'll be able to transmit the information to their cardiologist immediately. So there's this focus on creating more and more tools for people to do self-diagnosis at home and allow those tools to then filter who needs to come to what. So people are also anticipating that. Again, that's not going to be applicable in every situation, okay? So certain countries that will work, but obviously that solution requires a certain initial investment and expense, but my answer to your point is I agree with, of course, I think it's great that you have that model. I'm just saying, I just think that you probably need to attack it at multiple different levels.
That's why we commented that this model probably only be accepted in places which is affordable, but it is possible. Okay, that's the point I wanted to make. I know it cannot be applicable in other countries. At least the countries which can afford, this is applicable. Nowadays, most of our patients, they have got a monitor which they will just touch the skin of the body and they get the blood sugar level, which is transmitted to the endocrinology department. They keep a flow of their blood sugar level. So things are improved. It's only the awareness to the patient level which has to go, and also at the basis of the physicians. If they accept to do it, then we go into it. Thank you.
Now I remember the point. The point is, I wanted Geeta to be, she's an ambassador for cancer patients in India, and I think she has blessings of millions of cancer patients here because she collected 300 crores for Tata Cancer Hospital, and I'm trying to convince her. She also works for a special school called Sadda, and Sadhana, no? In Sophia school, and then she does multivarious thing. And again, she recently did 2 programs, one on Avyar. Avyar is a poetess who was living 2000
Doc,
years.
sorry to interrupt, this is about the eye.
No, I'm trying to soap you.
The
The idea is to make you an ambassador for ophthalmology. The scheme which I'm presenting to the All India Ophthalmic Society, and I decided to compete with our Prime Minister Narendra Modi in an app, as well as in the to reach the 73.1 million diabetics. So I want the Prime Minister to be awakened, and I hope somebody is recording this and he's seeing this. The reason is we have 73 million diabetic, and that Francisco Bandolo presented a similar talk last year on the oration, and he said if the 700 million diabetics are going to be not taken care, many governments will fall down only treating diabetics. So I found an idea. We have with Nilesh here, Dr. Harinder. Okay, we have a 10th standard fail, and also the social workers who are all 6th standard and 7th standard. That's the point I wanted to tell Geeta, to make sure that Geeta went and met Prime Minister. So I wanted to tell this because we have a lot of illiterate people in India whom we are training to use the mobile phone and take retina photograph, and they only have to use it is just to push the button and it will come to the cloud. We have already done a trial, and we are working with a company called Medios, which is located in Singapore, and also with the Indian company Remedio, where we have sent the paper to JAMA waiting for the publication and hope it's published. And we want to say we'll use online AI with Google, and I'm trying to get Sundar Pichai for the inaugurating the All India Conference on February 14th. And I want to use the offline AI, which we are using, where nobody has to use the brain. At least I want to tell Dr. Gupta here that because AI will not replace doctors, and even though it will replace reading center, it will replace screening. So according to me, AI is required because out of the 73.1 million, 30 million are walking, and maybe our representatives are here in this hall where they are diabetic and they don't know they are diabetic. And then if you diagnose them at the age of 40, and then you treat them, and then at the age of 50, in case he gets background retinopathy, we can probably prevent him and from blindness, and maybe he will live longer and be good for the economy of the country. So this is what I want as a social reformation, that every part of the country, including ASHA workers, we have 1 million ASHA workers. I went and told the Health Minister Nadda, but he's saying, how can Government of India buy a mobile phone, that is the iPhone, because right now iPhone is being used. So I told him, you don't worry about the money, and I went to Tata Trust, and Tata Trust said Maharashtra can be the first state to do that. They already allocated 2 crores, and we are doing it in whole Maharashtra, and tell the Government of India that when one state can do, I'm happy now. I went to Jharkhand, and Jharkhand is doing a screening program, and we have the regional director of the Minto Eye Hospital, Karnataka, Dr. Sujata Rathod. So the reason is I want every state, in India health is a state subject, and the state ministers have to take care. And here our team went and met and presented to Dr. Deepak Sawant, who is the health minister, and he has told you can use the pilot project in a new district called Palghar in the tribal area. So I think in the next 5 years, I want to screen the 73.1 million. By the time maybe it will become 100 million. But still, every year we will be screening, and we don't need doctors, and we don't need optometrists, and we don't need eye care professionals. We only need a man who can be a non-skilled, trained and semi-skilled, and only they're taking retina photographs. And then in the Government of India, there's a program called Skill Development Corporation of India, which if you give them, they will get without education, they can do a decent job and have a social reformation. And I hope to see a better India with a healthy diabetic. You may have diabetes, but still, as somebody pointed out, we can be trim and slim and in shape. Thank you.
I want to add one point. Dr. Shrinivas Reddy of Public Health Foundation has developed a digital device called as Fast Slate. And I'm involved with the product now, product in Manipur and GMP and where it can record the digitally EKG, the blood pressure and pulse rate, etc. But we never thought of doing the retinal imaging, etc. This will be a great thing because it is a handheld device. Asha workers have been trained in collective ideas that are 300,000 patients in Mumbai, 80,000 in Manipur. And all these are being done, they are being followed with the Department of Telemedicine which government of India established. There are a lot of satellite centers in northeast area and
Thank you, sir. I think we need you, and my classmate is the president of the Telemedicine Society. Yeah. No, we are part of the Public Health Foundation of India as a national expert in diabetic retinopathy, and we are also part of the Ornate India, which is a £6 million grant from Moorfield, and plus we want to London School of. By the time I finish 1 year, we'll have a program rolling down, and we should work for 5 years, and that's what I'm happy. The Ayatollah Jyot is doing, and I was enjoying with the Shrinivas Sadda in Mumbai.
Faculty, institute, and students, ladies and gentlemen. Good evening, and adab, salam, and namaskar. Because we are becoming more and more multi-faith and multi-religious and multi-ethnic people. Yeah, thank you. So we address him, or even sometime non-Muslim Christians or other. Then we have the good evening, which is European address mainly, and also the namaste. So thank you very much for inviting me, and to this very, I must say, it's a very important and significant event. Although I was not asked to be a speaker, but I feel a little bit privileged that I must share my thoughts and which I in fact learned from here. It's truly a very enlightening and instructive lecture, particularly people like me. I am little bit from the technical side. I am an engineer by academy, but I definitely love, the doctors, particularly doctors. They make our life comfortable, not only life, the health and everything. That we take care the infrastructure, the roads and others, the rockets even, but the doctors take care of us. So we must be thankful. My thanks and gratitude must go to the doctors. Everybody, we have some kind of disease, if not summer syndrome, and now there are a lot of people in the world suffering from various diseases, particularly as just mentioned, the eye problem and the diabetic, which is one of the most prevailing and malignant disease. They are killing a lot of people in our area, in our region, in South Asia, Bangladesh and India. And many people are suffering from the eye vision also, the lack of. So I also need to go to the doctors to, to wear the glass. So now every family in Bangladesh has, the members of every family has this kind of either diabetes or eye problem. So now we need more and more, in fact, eye specialists and also doctors who are very specialized in treating diabetes. The other issues which the doctor said, Dr. Sadda, on many, particularly technology and telemedicine, the idea of screening, all those are truly enlightening, and I hope that those who are students here, they must be, this must be great for them and must be useful to them. It's a eye-opening for me, and I definitely thanks Dr. Natarajan for inviting me. I would like to just, what I think at the last moment that many people talk about the artificial intelligence, and till today, till now, I feel that artificial intelligence will be a very much helping tool for us, but it cannot fully replace the people who are specialized. Particularly, I think that it will not replace the doctors. Particularly, doctors are very, very specialized persons in the world. So they will do, yes, help a lot of things to do and make our life more comfortable. But I think that AI will not in a position to fully capture everything from the doctors. And I wish best of luck to the doctors, that we need you and we need your support, and we love you, in fact, and we wish your continued success in your endeavors and also your prosperity and also your good health also, because this is also important. If you are not healthy, then you cannot make us healthful. Okay, so thank you very much for inviting me. I hope you are.
Remembering his parents, and this is very typically a Indian culture where we respect our parents from the time we recognize them as parents till their last breath. So I think this Indian culture is very much well depicted by Dr. Natarajan, who not only is continuing to remember them and in their name bringing more benefit to the society by getting esteemed guests like Dr. Sadda to talk on a great public health problem like diabetes retinopathy. Also, I've noticed that he's always has every small thing he does with a lot of compassion and passion. So that amongst his friends and family has taken him, has brought him till here to contribute to the society. Being a private practitioner, he could have just constrained or restrained himself to being a good, successful private practitioner, attending to all the VIPs of the country and just being in his comfortable, cozy chamber. But no, I think we have to take great lessons from him, where he's not only treating the extremely rich and affordable people, but he's going to the doors of the poor and needy. And he is continuing to be on the national level and the international level to do great service to the poor by reaching to their doors through this AIOS initiative. And he every time brings about newer things where he's identifying the literally, uneducated people also to be brought into this stream of service delivery. So with these few words,
It's my proud privilege and it's a great honor that I'm with all of you here today. Thank you, Dr. Natarajan, and the great team of Aditya Jyoth for this nice evening. Thank you.
She grandmother of Dr. Natarajan, and to felicitate her, there's the Indian Pen Pals League. Shri Karun, who does a lot of social welfare, would like to honor Archie and Dr. Sadda.